I'm going to say something that some may consider a little bit controversial. And essentially, what I've seen this week in clinic is several patients who've raised HbA1c. For those of you who don't know what that is, it's a measurement that looks at how much sugar is in your blood over the last 3 months. So it's giving a really reflective view of what's going on with your sugar. And obviously, I measure cholesterols for patients as well. And there's a real reluctance in several patients to be treated for this high sugar. Now, I'm not saying the first thing we should do is jump on medication, although that is a choice, it's available and it's out there. But I've had patients who've had a high blood sugar, HbA1c, for years, and it's creeping up and up and up. And what I'm saying is, of course, diet is very important, looking at your sugar intake, maybe wearing a continuous glucose monitor to look for your sugar spikes and what foods are sort of maybe triggering your high sugar. That is essential, of course. And there are supplements that can help with your blood sugar as well. Things like chromium can help with cravings for sugar. Things like berberine can sometimes help. Some of these people have done these things and their blood sugar, HbA1c, is not coming down. Why the reluctance to treat something that's going into pre-diabetes? Well, it is pre-diabetes, and then it's going to become diabetes, and it's going to have an impact on your heart and your brain health and your eye health and neuropathies and things like that. Again, we're in this very polarizing view. And maybe sometimes people come to see me for a holistic overview of what's going on with them. And I do believe in that. I am a doctor. I'm a medical doctor. And I've seen the consequences of diabetes. It's not something I want for myself or my family members. And I don't want it for my patients. And yet I've got people who are walking around with high blood sugar, which is causing inflammation in their system, probably impacting their heart health and their brain health and their neuropathies, and inflammation in the body. And chronic inflammation leads to disease. And I think we really need to stop this, I only do things naturally, I only take medications, and take the combined approach. Taking medication isn't a failure if you need it. Medication can be life-saving. And of course, the foundations of health and lifestyle and nutrition and exercise are essential. But sometimes, a lot of times, medication can also save lives. And I think it's about looking at this combined approach.